I'm teaching, is if one of these things go down, what you do here doesn't really matter. Everybody's going to be involved, and everybody's going to have the same responsibilities, and everybody's going to be thrust into the same terrible situation. You know, from when I teach at the schools, from the cooks to the aides to the teacher to the principal, everybody needs to be involved. Because the faster we can stop this bleeding on all these people, the better chance they have of living. All right? So I don't have a clicker here today, but like I said, this is a nationally recognized program. We've rolled it out. My chief, like I said, has given me the ability. I've taught this all over our city. I've taught this to a lot of the local schools that don't run this program. I've been to Strasburg. Brooks, Captain Ross at Dover Fire does Dover schools. I've done all the Philly schools. I had Buckeye. I've been here now. This is the second time I've been here, so I'm happy to come out and do this. There is no charge for this schooling or this training. We don't charge anything. I got a grant to buy all my equipment, so everything, this is just for the betterment of our community. So obviously the focus of the program, immediate response to bleeding, recognize the life-threatening bleeding, and appropriate ways to stop the bleeding. That's the whole course, all right? That's as simple as it's going to be. So most of these incidents that happen, they're terrible. They're going to be the worst day of your lives. But what these people are dying from, kids, people, whatever, is they're bleeding out before help can get there. All right? So I'll give you a little bit of a response of how it's going to go down, because I don't think everybody kind of understands how that day will play out on the response side from police and fire. So if you guys have an active assailant in this building today, wherever they get to or whatever classroom and all those injuries happen, the first thing that's going to do, we're going to call 911, obviously, say we have an accident, an incident going on. Police from everywhere in this county are going to respond. New Philly PD's coming, Sheriff's Department's coming, State Patrol's coming, Gennady's coming, Tusky. Any guy that hears that call go out that we have an active assailant in any school, any business, anything like that, they're coming. When they get here, no matter what is going on, their job is to come into this building and find the assailant and put a stop to it. Okay, that's their only job. So the first 5, 6, 10 guys that get on scene, their main focus is to come in and stop the assailant. They're not going to stop and render aid. They're not going to move people out of this building. They're not doing any of that. They're coming in here to stop the assailant. So what does that mean? That could be, they got a 3, 4, 5 minute response. A lot of damage can be done in 3, 4, 5 minutes, no matter what he's using or she's using, whether it's a gun, a bat, a knife. So until they get in here and stop it, as our county's set up right now, fire department, EMS, no matter where you're at, is not coming in to this building until the police give the all clear. So what's that say to you guys? That means I might be sitting out there with my ambulance that's $250,000 with every piece of equipment that could save a life, but I can't get in this building until the police give me an all clear. So that turns all of you into first responders. And if somebody gets shot in the shoulder, and that's all their wound is, in 10 minutes, 12 minutes, 15 minutes till I can get in here, they're going to bleed out and they're going to die. All right? So it's being thrust upon you, if you're not a victim, to be a first responder. And I can say whether you choose to be, whether you don't choose to be, the university has spent their money to buy these kits, which is awesome. They're going to be located around the school, and you'll be able to treat, what are those, are those the 10 or 20? I can't remember which one you bought. I think
these 10.
Yeah, I think those are the 10. Yeah, those are the 10 kit. So that one bag has the potential to save up from 10 to 20 lives if you know how to use it, if you know where it's located, and if you're going to be brave enough that day to step up and help these people. Students can use it. You can use it. Everybody becomes a first responder if you're not injured. That's how this is going to work. So when people think, I think, especially in our high schools and elementaries, they think, well, the fire department's going to come in and take these people out, and it's all going to be okay. Well, that's 15 minutes after the incident starts, and that's a long time. You can bleed out in 2 minutes. You can bleed out in 1 minute. So the more we learn with this, the better off chance of survival. We could cut the survival or the death rate in half just by stopping bleeding. All right. So moving on, I know that's a lot to put on you at the very beginning of the program, but that's the harsh reality of it. Some of the images are going to be a little graphic. We're going to show some wounds and stuff, something you're going to run across. It's nothing terrible, but if That's something you don't want to see. You might be asking, why do I need this training? It's not just for mass shootings or the incidents that I'm talking about. You could work-related injuries, come up on a motor vehicle crash. I know through this you're going to think I'm a little bit of a prepper, but I keep a med kit in my truck because I've come up on plenty of stuff and I'm standing there with not the ability to do anything. So home injuries, bombings, mass shootings. So these are realities of our world. Primary principles, ensure your own safety, all right? If you guys get hurt, you can't help anybody. So I'm not going to tell you guys do the Alice training you said here. So you've had some of that Alice training. So follow that. I know I've been through all of that. I've been through rescue task force stuff. I've been through all of it. So it isn't that big a deal. But first thing is alert, call 911. What they find happening is when a gunshot rings off, and multiple gunshots, you might assume, okay, somebody's handling that. Somebody's already calling 911, or you think, I don't need to do that. If you're in a secure room, get on your cell phone and say, I'm at Kent University, there's gunshots in the hallway. I don't care if it's in the office, if it's in your classroom, in a janitor's closet, it don't matter. If you hear gunshots and somebody needs to make sure you're calling 911, because if that ain't happening, the police ain't coming, fire department ain't coming, and it extends that time. So everybody that can needs to call 911. Bleeding, that's what we're looking for. Find the bleeding, find the injury, and then compress. So that's the ABCs of stop the bleed. Alert, bleeding, and then compress. And compress, we'll go over it. Sometimes just a wound, you put a glove on, put your hand right over that wound and hold pressure. 70% of the time that's going to be enough to get them through, all right? But you got all kinds of stuff we'll go over in there. So, and then if covering the wound don't use, we might need to use a tourniquet, which we'll practice today. And then something a little more advanced, but we teach it, is packing or filling the wound, all right? Safety, before you offer any help, you must remain safe. So we know this isn't going to be a 100% safe area. Here in Philly, the fire department's going to probably come in a little bit quicker because we have 3 guys on the SWAT team that we're going to partner up with a couple police that are left over. So we're going to get in quicker, but in the county, that's not how it's going to work. So we're a little bit different. At any time, if your safety's threatened, attempt to remove yourself. It might be hard. Protect yourself from bloodborne infections by wearing gloves. So pretty much simple stuff. Call 911. We shouldn't have to talk about that real long. That's you need to be calling 911. So here's where we start into the bleeding. Find where the victim is bleeding from. So if I'm shot in my chest and all you see is just a bunch of blood here, you don't know where to compress. And I know this is a hard thing for a lot of people, your teachers, your professors, your principals, young kids. You need to expose that, find the wound, and you need to put your hand right on that wound, or it's not going to do anything. So I know in my world it doesn't seem hard, but when you talk to people, that exposing somebody is a hard thing to get over. But it's the only thing we can do to make sure we're stopping the right thing. Blood that is spurting out of the wound, blood that won't stop, blood that is pooling, clothing that is soaked, bandages that are soaked, loss are all part of the limb. A lot of these in the active stuff is bullet wounds, but we've seen schools where they've set up pipe bombs on exits. They haven't, fortunately, went off. They haven't been good at that. But we could list any type of wound that you want it could possibly happen, all right? And that's just the truth of it. So here's some of the wounds we could encounter. This one on the left is a slash wound. So somebody with a knife hit them there. This is a pretty extensive wound. This is a knee, so a shin, a foot down here. So that's somewhere direct pressure is probably not going to work, right? So we're going to have to go a step further, and that would be a tourniquet. That would be a tourniquet call right there. So any of the wounds that can lead from death and bleeding. All right, so if you look at this foot here, if this goes untreated for 5 or 6 minutes, they're going to bleed out and they're probably not going to make it. That is a super survivable wound if we know what to do. All right, if we throw a tourniquet on right here, this person is going to last they're going to be an excruciating amount of pain, but they're going to live. Okay, but these are the type of injuries that we're finding in these incidents where people aren't making it, and it's a shame because they're survivable injuries. So the most frequent cause of preventable death from injury is arm and leg wounds. Bleeding from these wounds can be controlled with direct pressure or a tourniquet. Other wounds that we're going to talk about are junctional wounds. So any junctional area is a place where we can't get a tourniquet that doesn't involve a vital organ, all right? You get shot in the chest, there's a good chance that's going to be a fatal wound. We can't do much about that. But in our junctional areas, we're talking up here in our, from the collarbone and up to shoulders, down here in our pelvis and hip area, we can't tourniquet that, but we can survive these wounds, all right? So we're going to go over how we can help these people also by using direct pressure and wound packing. So this was a multiple gunshot wound, and he's back. There's a good chance he's got other stuff, so wounds that can lead to death from bleeding. These ones are a little more, they're not going to have a very good outcome. All right, any wound in that trunk area is. So these aren't the ones we're trying to look to save, it's the other ones that we're trying to. So ensure your safety, look for life-threatening bleed, a strong first aid kit available. So that brings us to the kits that your university has bought. What is in these, and these were actually bought through the Stop the Bleed Foundation that I teach through, and these are great kits. So this is what's in, so this one's open. So everything that's in here, I'm just going to go back. Alright, so, marker, got one pair of gloves, which you said you're going to keep spares in the front. Yeah, there's more in the front. So put the gloves on. We got a SWAT T tourniquet. We have just a simple cling bandage. We have another bandage, more cling. This is a combine. This is a pad, an absorbent pad that you can use to hold direct pressure. This is a thermal blanket, so after somebody, if you've treated them with the tourniquet or you've stopped the bleeding, they're going to go into shock. So this thermal blanket, it'll open up and it'll cover me. It's in this little pack. Just put it over, tuck it in. It helps keep them warm when you go into shock. A pair of scissors to expose. Like I said, you need to. Face shield, these are good. In that situation, the face shield is used to put between your mouth and somebody else's if you're giving CPR. So even if you're not having a multiple or an incident here, when your AEDs are by these, right? You said. So if you grab an AED in one of these packs and you're going to do CPR on somebody, you'll have a face shield to use. So you can open it up and get the face shield out. There's maybe 3 people on the planet I can get mouth to mouth to without a face shield, and ain't none of them in this room. So let's just put it that way. All right. So we carry all kinds of barrier devices too. So that's what you have. You also have, what's that? Duct tape. If it's broke and duct tape can't fix it, it's broken. All right, so what we can use this for is putting a bandage down, wrapping it tight. Duct tape just works better than any other tape. It does. So if you get the wound on a leg, we can wrap it with that, because these people are going to be drug out of this building. They're going to be moved rapidly, so normal medical tape tears and this stuff, that's what it's for. So that's the stuff in here. You're also going to have more Cat 5 tourniquets put in your bag, and we're going to go over all of this stuff, all right? So that's where the bags are. So now you know what's in the bags. Now you need to know where they're going to be, because if you don't have any idea where they're at, you're not going to be able to use them. So they've talked, they're going to put some by the ADs. They're talking a couple in this building, a couple in the pack maybe, and a couple in the nursing building. So spectacular that the university is taking the steps to buy these bags and provide that. So like I said, when I say there's 10 kits in here, we might be able to use this tourniquet on one kid, this tourniquet on another kid, stop some bleeding with this bandage, put some tape on it. So now we've saved 3 lives with one kit. So this 10 kit bag could save up to 30 lives, all right? So it's good value for your money. I can't buy this stuff at the fire department cheaper than you can buy that kit. They run a special through Stop the Bleed for municipalities, for schools, so it's a good thing. So, all right, direct pressure. Very simple. If I got a wound here on my arm, I put my hand through a plate glass window or just have a normal injury here. Put a glove hand over that, pull pressure on it, it's probably going to stop eventually, right? We've all done that. Now, if that wound's gaping open a little bit more, putting my hand over it isn't going to stop that. So what I can do is take one of these, kind of shove it down in there, and then put pressure on it, right? And keep that wound, fill that up, keep that wound from going. We carry Quick Clot at the fire station. The stuff is absolutely amazing. You guys don't have that in your kits, but we do. I just bring it to show. What this is permeated with a medicine. So the medicine induces clotting. So we shove that in the wound. It actually starts clotting instantly. The medicine used to be sprinkled in wounds. Everything we do comes from the military. So they use that. Problem was in deserts and helicopters landing, that stuff would blow out of the wound, or when they were using it, hit them in the eyes, they wouldn't be able to see because it does the same thing to your eyes as it does. It dries them out, can't blink. We got rid of that pretty quick and put it on the pad. So hands, fingers, anything you can do to put direct pressure on it, that's a good thing. So very simple, that's the first thing we do, gloved hand, direct pressure. Just some different pictures here. You can see this girl doesn't have, it's not a very big wound. If it's not bigger than your hand, you should be able to put direct pressure on it, hold it there for a while. Our bodies take care of the clotting factor and we're good to go. Just like he's doing. And when we put pressure on it, it's not just holding it, all right? You gotta pin it down and put some pressure on it to get that to work, all right? Is a trauma kit, first aid, yep, it's there. Where's the wound, arm or leg? Is a tourniquet available immediately? You guys can say yes because you will. Apply a glove to the bleeding site, tighten until the bleeding stops. That is about all you need to know about applying a tourniquet. And we're going to go over how you apply it, but that is the basics. If the wound's here, it goes anywhere above it. And then we crank that thing until the wound quits bleeding. It's that simple. Tourniquets used to get a bad rap back in the Revolutionary and Civil War. They used a tourniquet, they just tightened that thing down and they used it to cut your leg off and get rid of the wound. And that's why everybody walked with a peg leg or a stick or anything. In Korea, they abandoned them altogether, the military did, because they weren't having very good survivability rates, because they kept taking them off and checking the wound, taking them off while people would bleed out, and it wasn't working. Well, starting about right after Desert Storm, the military reintroduced tourniquets again. So if you've paid attention in the last 15 years of our military coming home from service, a lot of guys are coming home without arms and not legs. The reason is because we've instituted tourniquets and we've instituted wound packing. Those guys didn't come home before. They died on the battleground, they bled out. So now we're using tourniquets. These guys get to come home, they're just minus a leg or minus an arm, which, yes.
So is it true that you have to release the tourniquet?
No, that is all false.
Yes.
That is the exact thing that got them thrown out of being used. So basically, when we apply a tourniquet, what it does is it stops blood from coming down, but it also stops the blood from going back, right? So if I put a tourniquet on here because I've lost my hand or fingers, all this cavity in here has bad blood in it because it's not getting oxygenated, it's not circulating. So I put this here, so all this blood is pushing here, and then the rest of my body's doing what it's supposed to. So when we release that, okay, when we release that, it does two things. It lets this blood push and causes all the clotting factor to go out that we just established. So it's going to start bleeding again. And it also lets all the bad blood recirculate to my heart, which if we don't treat that with sodium bicarb or a drug, it is bad for us and it kills us.
Why did they say release it then?
They didn't know any better.
They didn't know.
Yeah, they just didn't know any better. And studies have shown compartment syndrome. You know, if you guys have ever heard of somebody got their legs crushed and they were pinned, and as soon as they remove the pin from them, that blood circulates and they die instantly. And that's just because of the bad blood getting to your heart and it can't sustain that. Or it throws a clot because that blood will clot and then it moves, so you'll get a stroke. There's all kinds of things. So once we put a tourniquet on, the only person that's taking that off is the surgeon. Okay, they can be on up to 24 hours now without real bad damage. They can fix that, you know. But most of these people, from the time we get here, we're going to get them somewhere, and they're going to be in surgery within an hour and a half. All right, if they need surgery. So the surgeon will take that off slowly. They pre-medicate them with the sodium bicarb to defeat the compartment syndrome. They fix the wound, and a lot of times these people do fine. So what we see coming back from the military is the IEDs and stuff when they get part of their leg blown off, you know, riding in that Jeep or Humvee, they put the tourniquet here, and they want it to get as close to the wound as they can because they're going to lose the rest of it probably because of the damage. So they'll tourniquet right above the knee. This will all be terribly injured. They cut that off, they suture it, they fix it, they clamp the vessels, they come home. But in Korea, Vietnam, those type of injuries, they just didn't make it. So Everything, like I said, is tested through our military, good and bad. So EMS, modern EMS is all from the military. So the tourniquet. So now we're talking about bleeding that we can't stop with direct pressure, okay? So you guys in your kits are orange. A lot of the commercial ones are orange or black. So this is what you'll be looking for. This is how it is packaged. All right, that is called the Cat 5. Mine are trainers. All the trainers are blue. Mine are meant to be used over and over and over again. Yours aren't. One-time use, they're gone. We don't repackage them no matter what. All right. So the way that comes in the package, it would be just like this. That is how it is packaged, except it's got some plastic cellophane on it. All right. So you rip the plastic off. We grab here, open this up. That's big enough to go on 90% of the population's arms. Okay. So you want to be my dummy? So I can take this. He's got a wound here that I can't control with bleeding. I can put this right up over his arm. I open my Velcro by the red tab. I pull this as tight as I can get it. Run the Velcro down as far as I can go. And then I'm left with this windlass right here, this stick. All right, I don't care what you call it, if you want to refer to it as a stick. And I'm going to turn this and I'm going to wash his wound. And as soon as that bleeding stopped, I've turned it enough. Okay? Take it off so I can show you. So once I've turned it enough, I tuck this into that plastic piece. That way it won't unspin. The way you can spin it either way, it doesn't matter. So we tuck it in there, and our tail, this tail right here, we tuck into that right there, and then we take this white piece and lock it down. All right, and we're going to do this, so don't worry about it. We're going to team up here in a minute. And the reason we lock that tail down is on this carpet. If I come in here and we're trying to get somebody out of here, and this Velcro grabs on the carpet, and I don't, right here I can pull on that and it won't unlock if I don't lock that down. This is going to grab carpet and open up and let that tourniquet fall off. All right, so that's the one slight design flaw, but they need to have the Velcro all the way around to make it work. So if you guys want to grab a partner, we'll go two at a time, and you guys can practice a little bit putting these tourniquets on.
I'm done.
Above the bullet wound, stop my bleeding, because I can't hold pressure on that, because I'm going to get shocky and I'm going to pass out, my hand's going to fall away, and I'm going to bleed out, and it's no good. So what you can do, put it up on your arm yourself, get it as high up there as you can go, pull straight down. You see how it just cinched down? And it also puts this windlass. So I want to turn this windlass a little bit so I can get at the crank. Lean up against the wall, pull that thing as tight as you can, and then crank it. And do it fast. Get it on there, and then lock it down. Hopefully it stops your bleeding. You can kind of get back in the fight, or you can get out to safety. All right? So if you're laying down, get up against the wall, pin that thing, put it tight, and put it on yourself.
Do you recommend putting these on bare skin? And
Yes.
Like if
Yep.
the wound is down here,
Yeah.
and I have a short
Expose
sleeve
is
shirt.
the first thing we do, because if you're shot here, yeah, and you're bleeding here, I don't know if that wound's here or clear up here.
Okay.
So I need to expose it to see where that
Even
is.
if the wound's here, you want to open.
Yeah, yep, just not on a joint, all right? The other thing that I don't think a lot of people that teach this class, but they haven't used these, don't tell you, it's going to hurt. They're going to scream. They're going to yell. It's going to be awful. You just got shot, now I'm putting a tight band, and your whole body's going into shock. It's going to be terrible, all right? So don't not expect that. So what happens is we're cranking that down, and they start screaming, and we don't want to hurt them, all right? But if you don't crank that enough to get that bleeding stopped, you might as well not put it on, all right? So just know that in the back of your mind, that that's what's going on, okay? So, like I said, this isn't going to be your best day. It's going to be as bad as you imagine it's going to be. So, okay, I've got a couple, so we won't open yours. Put them in here. I bring everything the kit has. All right, so these, I showed you what was in your kit. This is called the SWAT T. This is another brand, another style of tourniquet, all right? There's advantages and disadvantages to using either or. So the big advantage to this, you've seen, I just showed you in 5 minutes how to put it on pretty simple, right? You really can't screw this one up too bad. You pull it tight, crank on it, it's gonna stop the bleeding. Downside to that one, it's only for one use. We can only use it one time, put it on one appendage, and we're done. Correct? Everybody understand that? So what this is, I wish I would have marketed this, I'd be a millionaire. They were genius. Just a big rubber band, all right? It's stretchy. It has directions right on it. So we'll pass these around too. So when I stretch this to get the type of stretch I want this small circle to look like the big circle. And then I want these little blocks like these big blocks. So it shows you what you're supposed, how much tension you're supposed to put on that, all right? So you can watch these little blocks up here in the block in the circle when I pull it. It's, see how they spread out and look like that one? That's showing you the tension you need to put on that. So Dina, if I could use your arm again.
Bear.
Yeah, bear works a little better. So the way these work is it's just a wrap. So say his hand's cut off and I want to use the tourniquet there. My first wrap doesn't have to be tight because all I need to do is get this rubber to stick to itself, all right? So once I get that rubber to stick to itself, I start pulling my tension. That's all it is. So now, if I put 4 wraps on that and his bleeding stops, I can probably check his pulse and it shouldn't be there, all right? So what the cool thing is with these is now I can cut this, put a piece of tape on it, tape, cut this, now I've got this much more that I can go treat somebody else. Okay, so I could treat maybe two adults with this, or if I'm in an elementary school, I can treat 6 kids with this, all right, because their appendages are way smaller. So all we do is wrap that until, tape it down. You get an elementary school kid, this ain't gonna work on them on an arm. It just won't shrink small enough, so that's why we put these in the kit too. All right, so you guys can kind of mess with these. Get back in your teams there. Huh?
I said that was painful.
And, sorry.
No, I mean, you said it would be painful.
Yeah,
I can imagine with a gunshot when the
yeah,
end is.
yeah. You put this, we can also put this around the wound to hold it tight. So there's very good uses for this.
Yeah, how would you self-apply?
You don't.
You
That's
can't.
one of the downsides to this tourniquet. Self-application with this is hard. Because the other part is you gotta remember you're bleeding. It's gonna slide, so you need 2 hands to get it around at least once.
the arm down while you're doing so.
All right, so this is not a self-application tourniquet. You can keep it in your drawer. You don't gotta run to get the bag to have a tourniquet. It's one of those things that, you know, I pushed our high school teachers, you know, even if you gotta pay $12 out of your own pocket, you might be able to save 2 kids' lives just by throwing one of these in your drawer, all right? So these are, I like these. I like them real well.
Now, should you
Right, that's how I get to why we have them there. Yep. Any questions on the SWAT Ts? All right. The other things we have in our thing, like I said, these are all bandages, pretty self-explanatory, but you might wonder why we have a Sharpie in here. You have a Sharpie in here for 2 reasons. On the Cat 5, when we put this on, if you're not taking fire or you're not being actively pursued, if you can remember to write the time down, and it says time on them, they all say it. It'll say time right on your thing. If you write the time down, that gives the certainty and stuff. If we're triaging kids or people, you know, and we're getting up to that 12-hour mark or 13-hour mark where they really like to get these off, they might bump them ahead. You know, that's the only reason we mark a time on it, is to get them a little further into surgery and know how long they've had that critical wound that we use it. The other thing that is in here that I really don't see you guys using, it would be more for us if we came in and used your kit, is a triage. So nurses might have some training in that, but triage in the field is pretty, you know, so You just pin it to them and say, hey, this is what they have wound-wise, this is where it's at. So you could do that, you know, bullet wound of the right arm. You know, you can put that in circle of the right arm on here, so down the road. But that's, I think, asking a lot of you guys to do in that situation. If they put them in there, I understand why, but I think that's a lot to ask. So I know that was quick with tourniquets. Any questions on that? Everybody feel like tomorrow you could put a tourniquet on somebody and stop bleeding? Okay, so something else that I like to talk about. You got guys my size in this building, I'm sure, at all times, kids or adults or whatever. If I get shot in the leg, right here, and you got to put a tourniquet on my leg, you're going to crank and crank and crank, and there's a good chance you ain't going to get that bleeding stopped, right? Can we put 2 on? Nod with me. We can put 2 on. Put 2 of those on, stack them, you might have a better chance because you got 2. And if that don't work, you're going to take your knee and you're going to put it in my groin right here, and you're going to pinch off that femoral artery, and you're my lifeline. If you move, I die. All right? So this stuff isn't, this is kind of cut or go. You know, it's one of those things. So tourniquet use, very easy to do, should be taught everywhere in my opinion. That's why I do this. So we apply it immediately after life-threatening bleeding is seen from arm or leg. Placed right on top of clothes if necessary, but we want to expose if we got the scissors in the kit. Place 2 to 3 inches above the bleeding wound, higher on the arm or leg, but don't apply over the joints. Like I said, we can't compress the vessels around the elbow and around the knee. Okay, so we want to put that above or below it. Do not apply directly over a pocket that contains bulky items, obviously. You know, like me, I always have a pen. A lot of my shirts have it. If you're not going to get that squeeze you need to get, so remove the pen. Cut the shirt off. All right. Different styles. You guys have this CAT application tourniquet, the first one, which is the one I would say. The other ones do the same job, they just work a little different. So the easiest one is the one you guys got in your kit. That's why they used that one. Obviously, it's called the windlass rod. You can call it the stick, whatever you want to call it. We already did all this. I kind of jump ahead. I like to show you instead of just doing it through this. So you can see how he tucked that tail down in. That's pretty important. Once you get it tight, get the windlass, get that tail tucked down in. And then this next slide shows him putting the white right over it, right? Okay, key points. Using one of the recommended tourniquets is a safe procedure. Homemade tourniquets, which we didn't hit on very much, but they're less effective, but they're still viable. Everybody in here wear a belt. Most of the guys wear a belt. If that's all you got, and it's the difference between not doing anything and trying a belt, try a belt. If you got a towel in your room, or rip a piece of that, get a ruler or a stick and run a knot and just keep turning it. Try anything. All of that stuff will work. Yeah, a shirt, sure, anything. I wear, and here's one of my prepper things, I said it last time. Every belt I wear is one of these nylon belts that can shrink down to about that big. I can make any one of my belts into a tourniquet instantly, because it just will pull that tight and I can get enough torque on it. It's not a leather belt with, you know, it only goes so far. So just something I've always done. If the bleeding is not stopped with one tourniquet and is as tight as you can get, right here on this is showing how to double stack a tourniquet, like I showed and just told you. All right? No amputations. This is where they come in with all the information we've learned. No amputations ever been caused by a tourniquet when left in place for fewer than 2 hours, but it is best to get the patient to the trauma center as possible. The bleeding can be completely controlled and tourniquet removed. So the faster we get them there, the better. All right? Better to risk damage to the arm or leg than have them die. I mean, that's what we're talking about. If you don't do anything, they're not going to make it. And the training tourniquets should not be used in a real patient incident, obviously, because they're been used so much. Here's where they take, it's going to hurt a lot. Pain does not mean you put it on incorrectly, it just means that you're probably doing it right. And they are correct. Once we get here and get people out of the hazard, we'll treat them with all kinds of pain meds and put them to sleep and do all kinds of stuff so they won't even remember a lot of it. So, common mistakes, not using it or waiting too long to use it. You're afraid to use it. You shouldn't ever be afraid to use a tourniquet now. There's nothing to it. Not making it tight enough is usually the big problem, because people start screaming in the pain, and we as humans don't want to hurt another human, so we back off. So not using a second tourniquet, and like you said, the periodically we don't loosen it anymore. All right, that's not what we do. So that was one, and it causes unacceptable additional blood loss. And like I said, it says only a paramedic or a physician should loosen it. If one of my guys comes here and takes your tourniquet off, that shouldn't ever happen. All right, that's not how we do it. We're not taking them off. Once they're on, they're on. Now, what we might do is we might get here and tighten it. So that if you see us messing with it, it ain't loosening it. It's giving them another crank, so we know. Anything about tourniquets? Pretty easy. We did the practice already. Like I said, I don't like their layout, so I do it first and then use some questions. All right. Use hemostatic bleeding control gauze. You guys don't have that in your kits. This is what I was talking about with our kits that we carry. So there's two types. I won't spend a lot of time on them. Just for your information, you can maybe get a couple pads of this and shove it in your bags. You can order this too. So there is 4x4 dressings. This is the hemostatic agent. It's got the chemical on it that creates clotting. And then these are just pads. And then when we get into wound packing, this is the preferred use for wound packing. So you can see, and when you feel this up here, you can feel it's got something on it, and that's the chemical. And then this blue line, everybody asks what the blue line is for, and that is when we put this inside and pack a wound with it, it shows up on x-ray. So they can see it, so when they debride the wound, they know they don't leave 1.5 feet of this inside your body, which is never a good thing, ever. So, like I said, these pads, you guys, you probably need a couple bigger rolls of cling, but that'll be okay. That's something that's easy to get. But if you threw a couple of these in, it probably wouldn't hurt you. These work great. And like I said, I don't sell any of this stuff. I'm just telling you from experience what works. All right? So yeah, them are our hemostatic. We don't spend a lot of time on that because they don't even put them in their kits unless you get the way high kit and nobody gets those, so it's no big deal. We carry it on the squad. So there's the two hemostatic dressings that we use. So we're on to wound packing. So this is the part of the class that everybody, so if you guys want to come on up here, we'll go over this real quick so you guys can kind of see, and this is a more hands-on. They're a very real reality. You know, working with the SWAT team when we make entries and do all kinds of stuff. Thank you, sir. When we do all that, so entries have a high risk of somebody being shot. Well, it's my job to fix that when we get there. So, but this is right into the bleeding control. So let's pretend you had an incident here. Somebody catches a round, like I said, to their thigh. It's right here. You can't. All you can do is put your knee on it, and then you can't move, or they're not going to make it. So this is simulating the feet are down here, the head's up here. All right. So this would be the vessel coming down your leg, your femoral artery coming down in from your heart. So this bullet wound has a good chance of clipping that, and they're going to bleed out relatively fast. All right. So if we don't do something for this wound, they will die. It's not a question of if, it's just a question of how fast. I don't know if you guys are movie buffs. Did you ever see Black Hawk Down or read the book Black Hawk Down? All right. Do you remember the scene where they drug the guy in off the street and they go fishing around for that vessel, trying to clamp that? He's laying there screaming and yelling, and they're trying to dig in there. This is the wound he had, all right? So this is how they could have treated it then if medicine would have caught up, but you know, it wasn't there yet. So anybody want to be a guinea pig? You ain't gonna get hurt. So let me grab a map here. So this person's been shot, they're laying on the ground, things ain't going good for them that day. So to stop this bleeding, we're going to come up, we're going to put our knee right in their groin, you know, we're going to put it, and all our weight needs to be on that, you know, and it's going to slow this bleeding down. What you're going to have to do, and if you have one of the kits, you got cling there that you can do it with. If you don't, last ditch effort, whatever cloth you have, because we'll worry about getting them on penicillin and treating the infection later. If you don't do this, it doesn't matter. They're not going to make it. So we got our knee up here. They're going to be bleeding like that. And we're going to take this. I'm going to let you do it. I'll show you once a little bit here. Take our gloved hand. we're gonna take the first end of this gauze right here, okay? And we're gonna go towards the heart. I'm gonna push that down into the wound very slowly, because if that bullet's hit the femur and fractured it, I don't wanna shove my finger down into a sharp piece of bone. All right, so I'm gonna go in there, and I'm just gonna keep folding this over and putting more and more of this into that wound. All right, so go ahead and you can try that. And we're going to fill that entire cavity with that gauze. We would be using, at the fire department, the hemostatic agent. You guys are going to be using this. So, anybody else want to give it a shot? I got gloves here if you want to try it. See what it feels like. You want to try it? Here, let me cut that and we'll start over. So look, and that's not even close to how much will fit in there. So I don't know if anybody here is a hunter or shoots very much, but ballistics of a rifle round. Let's talk about the assault rifle that's in the news. Everybody talks about assault rifles. That bullet is only about that big when it comes out of that casing, but it's spinning, all right? And it's coming at such a velocity, when it hits that leg, it's going to go right through, but it's going to cavitate in that leg and it's going to cause a shock wave. Basically the same thing. So it's going to leave a big hole. So that's why we can fit so much of that in there. 9mm round, self-defense rounds, they spin, and when they hit, they open up like a butterfly. So then they're spinning and they open, so they create a bigger hole, right? So that's why we have such a wound pattern in these, that we can fit so much gauze in them. The other thing you got to remember, if I have a bullet wound here, where else could I have a bullet wound? At the back, right? So if you're focused on this, you're packing this, and you don't look back here, they're just bleeding out here. So you might have to roll them up on their side and pack both ways. Okay, go ahead. And when I said tourniquets are going to hurt, this is going to hurt. Not even close, right? This is going to be the most excruciating pain I think you could possibly have.
Go unconscious.
Yes, you're hoping they
That
go
would be
unconscious.
helpful.
Honestly, you're hoping they pass out. Truly, truly, because this is going to, it's bad enough. I've been told plenty of guys that have been shot, it is terrible. And then now we're repeatedly sticking our finger into that bullet wound. I mean, good Lord. Pretty cool, huh? Well, yeah, in my world, it's pretty cool. Anybody else want to give her a go? All right. There you have it. All right, so that's wound packing. Like I said, if you've got your rolls, open them up and just start putting it in, go towards the heart and pack that as hard as you can. And that's what I was saying about the SWAT T then. I would open this up, and on that person's thigh, I would leave whatever I couldn't get stuck in there on top, just like that. And then I would wrap this SWAT T around there as tight as I could get it to help hold that pressure. All right? We're making that leg smaller and tighter and trying to clot it off.
Now, like this is one for a fatty tissue. What if you got a bullet wound through the kneecap?
Tourniquet right above it.
Right up.
And
there's nothing you can't tuck in there.
Nope.
Because all
The only place that you can do the wound packing is thighs,
fatty
up here, and maybe a little bit of the pelvis, because there's not a lot you can get into other than the bladder maybe. So if it's inside here, I wouldn't go shoving too much in there. And then up in here above the lungs, we can pack up here. All right, so those are your junctional areas. Remember when I said junctional areas before, anywhere we can't fit a tourniquet, we can pack. All right, so yeah. So you can maybe get a tourniquet above this one, but you're going to really have a hard time on somebody my size with my legs getting that flow to stop. So the best route is to do this. All right. Okay, you guys can sit back down if nobody else wants to go. You feel here, if they miss the clavicle, it'll come right through, go right through the scapula. It'll just right through. So you might have to pack wounds on both sides. All right. So pack the wound, hemostatic, gauze roll, clean cloth, whatever you have. If you got to tear your shirt up again to get enough material to get in there, it's okay. The alternative is death. So whatever you can do to try to help them, they're not going to make it if you don't do anything. So here's a little bit of this isn't a very deep hole and not a very cavernous hole, but what it's showing you here is if we get this packed down in there, we're going to stop all this bleeding all the way around here in any vessel that's coming in here, if we just lay on top here, look how much of that that's not getting stopped, and it's gonna pool out and bleed. Human my size, or an adult male, can hold up to 2 liters of fluid in their thigh and their pelvic area. So our body has 5 to 6 liters of fluid in it. So 2 liters of fluid is a significant blood loss. You know, we're talking 20%. So it's no good. Quickly apply, hold pressure directly over the packed wound until relieved. So if you don't want to keep your knee on that, we pack it and then we wrap it with that SWAT tee, then we can help other people. All right, that's kind of the initial goal. If the initial packing fails to stop it, pack a second gauze on top of it. You want to fill it until you can't put any more in it, and don't worry about what that, just keep until it's full. Any questions about wound packing? Okay, practice, we did it. So, bleeding control in children, and all but the extremely young child, the same tourniquet used for adults can be used in children. So, from 4th grade and up, the blue one will probably work on most kids, not the skinny little girl with my daughter. It would have never worked on her. She's tiny like her mom. So he could have probably done it in the 1st grade. It would work. So, it's just, when we do these kits, if you're going to do, like if the schools would all combine and do all 1st grade in one, you'd want more SWAT Ts than Cat 5s. So it's just, that's all it's saying there. For the infant, a very small child, tourniquet too big, direct pressure. So if we got an infant that we get direct pressure, we're strong enough to hold pressure on a baby that we don't need a tourniquet. You can include vessels on a baby so it's not too bad. After arrival, after we get here, you have blood on you, wash it thoroughly with soap and water, remove all blood, and notify medical responders you've been exposed. In a situation like that, anybody that helped anybody that got blood on them is going to be taken to the hospital. They're not going to know, unless you had just your classroom and just 2 kids, they can test and see if anything was communicable. But if it's a mass casualty situation, you're just going to go back for periodic testing on 3 months, 6 months, and a year. So that's how that's going to work. There's no test they can do instantly to tell you you're clear. It's a process. Same thing if we get stuck with a needle or anything. So just is the nature of it. So in summary, I know I'm a fast dog. I'm kind of bouncy, but ensure your own safety is number 1. The ABCs of bleeding. Make sure you're calling 911. Bleeding, find it, expose it, and then compress it. And we showed you all kinds of different ways to compress it, with direct pressure, with tourniquets, with SWAT T tourniquets, with wound packing, gauze, duct tape. Use your kit, know where your kits are. And that's really all I got for you guys. And I know it's kind of down and dirty, but that's what it is. There's not much to really talk about other than those things. Only thing more tragic than death is a death that we could have prevented. And I totally agree with that, and that's why I volunteered to roll this out. If you guys saved 1 kid because they didn't bleed to death, or 1 person, or 1 whatever, it was worth me coming down here and spending an hour and a half with you. So that's why I do it. Yes, sir.
Obviously, someone to use these kits can't have a problem with blood.
Nope.
You don't want anybody
No.
passing out
No.
once they see that blood.
And I will tell you, and this is, you're gonna laugh at me, and I can't guarantee this, it's just what I've seen. Anybody thrust into this situation will not pass out when they see blood.
Really?
Your endorphins are so high, your adrenaline is so high.
You're not even thinking.
Nope. First of all, you're fearing for your life, so you want to go to safety. So there's a lot of people that are just going to go, okay? And that's where our flight or fight comes in, all right? So you need to know, you probably know sitting here, and we don't need to talk about whether you're a fight or flight person, are you? So, but you'd be amazed in a situation like this, when you see humans, you're going to know these kids. You've been with them for so long. You're going to know the student or your coworkers. You're going to want to help them if they're hurt. So that, you're not going to pass out. You're going to do what you're supposed to do, and if the more you get into this stuff and the more you get your hands on, the easier it'll be.
I tell the students or whoever in the Alice class that maybe you can't deal with that situation,
Yeah.
but if you know where that bag is, you
Yes.
can go get it.
Yes.
So
Yeah.
you're just as important as the person
Yep.
applying the aid.
And here's my whole thing on this, and my kids would have probably gotten, they graduated from New Philly. My daughter's actually a senior in high school here taking the classes. She's going to Maine next year for teaching, so she'll be with you guys at some point, probably. But anyhow, I told my kids, if you're on the first floor and you hear gunshots out that door, get out that window, go. What? That's just me. You know, why are we gonna sit and why are we gonna, you know, I've been through the Alice training, I've been through all this. I've seen the realities of it. I'm not gonna wanna be, I either wanna go fight it head on, or I wanna get out of there, you know, and I know that's my struggle with how, and you guys don't have any options. This is what the best thing, and this is what they're proving, but you know, my kids would have probably got yelled at, but they would have been sitting beside me at the dinner table that night. But you won't pass out, trust me. I've seen people come up on car wrecks and do amazing things for people to save their lives, just because humans, for the most part, are good-natured and want to help each other. And I know that's hard to believe in today's day and age, but I think it's true. When disasters strike all over the country, you see all the people flocking to help these people, and that's not just because they're adrenaline junkies, or it's because there's good people in the world that want to help. So that's my spiel. Any questions? I really appreciate you guys taking time out of your day. I know it's lunchtime, and I appreciate you coming out. And as many times as you want to put people through this, I'll come down and I'll teach you. So, thank you.
We'll be asking you to come.
Yeah, yeah.